Women in New York now have their abortion rights protected. Governor Cuomo signed the controversial bill into law this week. It had many critics, but some say there are major benefits to this health act that are not getting a lot of attention. 7 Eyewitness News reporter Ed Riley explains.
This was the scene inside the New York State Legislature when the Reproductive Health Act was finally passed. The video was taken by Republican Assemblyman David DiPietro, who posted it on social media after voting against the bill. And the celebrations continued when Governor Cuomo signed the legislation into law.
And we won after a long fight.
It is a controversial law that groups like the Catholic Church strongly lobbied against.
They argue that it would permit late-term abortions, past the 24 weeks.
It does not.
It does not.
No, there is specific language in there that still prohibits abortions after 24 weeks.
Dr. Vanessa Barnaby chairs the Department of Obstetrics and Gynecology for the UB Jacobs School of Medicine. She said the medical community needed the law to finally update New York's abortion laws, which were written before Roe v. Wade in 1973.
I think the primary thing that the act does is it decriminalizes abortion.
The new law will allow non-doctors to perform abortions, something Dr. Barnaby thinks will help with a shortage of abortion providers in upstate New York.
It's not that complicated a procedure, and I think other health professionals besides doctors could be trained to safely perform abortions.
But the doctor feels the abortion debate overshadowed other important provisions, such as the requirement that contraceptives be covered by all insurances.
There's a lot there. Other things, it improves access to fertility services. It ensures that pregnant teenagers will be able to stay in school.
And the new law will establish a maternal mortality review board.
Traditionally, New York has had one of the highest maternal mortality rates in the country.
The New York State Catholic Conference was very much opposed to the Reproductive Health Act. It's unknown at this point if there will be any legal challenges to the new law. In Buffalo, Ed Riley, 7 Eyewitness News.
Coming up next.